Greetings from Dr. G, your favorite dentist. I would like to talk to you about root canal therapy. In general, they call it having a root canal. Everybody has a root canal. It's a root canal therapy that people have. So, what I want to talk to you about is, why do we need a root canal?
Why?
And from there, educate you on, is after root canal everything done? Do we have to worry about anything else? So, first and foremost, you should never allow a little cavity on top of a tooth like there. Or let's say we have this tooth right here. A little tiny cavity on the surface of a tooth or the side of a tooth. We should never allow that to get larger and get into the nerves. As you see, this is the enamel right there. The second layer is dentine, and then right after that is the root canal. This is where the nerves, there's a blood vessel that actually delivers blood into the tooth. There is a blood vessel that actually returns the blood from the tooth. And then there's also the nerve. As you see, there are three different things that go into the tooth right here, as you see. You see? The white one is the nerve. The blue one is the blood that's coming out of the tooth. And the red one is the blood that's going inside the tooth. So, when you do not get to treat the cavities on time, and you don't take care of little decays, they will get larger and they will get into your nerves. And at that point, it's too late. And at that point, we have to have root canal therapy. So, what is a root canal therapy? And by the way, sometimes also, as you see, there is a little infection at the tip of the root right here. And that infection, you don't necessarily have to have a cavity on top of the tooth or coming from the crown of the tooth. Sometimes a tooth has had trauma to it, like something hits your mouth.
What the hell are you doing?
And then this tip of the root gets infected, and in that situation also you need to get a root canal therapy. So in the situation of a root canal therapy, we access the top of the tooth from right here, and we go inside the canal, as you see right here. We go inside the canal, and this is all cleaned out by special files. And after all of this is cleaned out, then a special material called gutta percha that fills these canals. Basically, it's a synthetic material that we fill these canals right here and seal them so bacteria does not get inside these canals. Once these canals are sealed, then a crown is indicated on top of the tooth, because when a root canal has been performed, the tooth does not have any more moisture in there because there is no blood coming in and blood going out. Therefore, the tooth becomes very dry and becomes desiccated. When that dryness takes place, it's just like when you go hiking and you pick up a piece of a bone, and if you flex that bone, and that's flexing back and forth, that means this piece of bone you found is an animal that has not been dead for too long.
He says he's not dead.
Yes, he is. I'm not.
He isn't.
Well, he will be soon. He's very ill. I'm getting better.
No, you're not. You'll be stone dead in a moment.
This bone is still resilient and is fresh, and it doesn't break easily. Now, if you pick up a bone when you're going hiking and you see a piece of bone somewhere, and you bend it and poof, it becomes like a powder. That means that bone has been there for a long time. So because when you basically dry the tooth completely from any kind of moisture and deprive it from any kind of moisture, the tooth becomes vulnerable to fracture. That's why we put a crown on top of it, to preserve it so it does not fall apart. And that's a different subject if we're going to talk about the crown. But now focusing back on root canal. When you get the root canal done, is that all done? Is that complete? Is that the end of the story? Most of the time, yes, but sometimes not. And here is what happens when the root canal is done. There are many factors. Sometimes you have what's called an accessory canal. You can only go with a file down these root canals. Sometimes a canal is, the root canal goes down like that, and then there is a side canal on sideways, just like that. Your file, when you're cleaning the root, you cannot just file down there and then have a file that bends sideways 90 degrees and go out like that. So therefore, those accessory canals get infected and they cause problem. Even though you have had a root canal, the tooth still hurts.
It's my tooth! It's my goddamn tooth! I can't even think anymore because of it.
I am not saying that if a tooth is hurting even after a root canal, that means the dentist has not done anything wrong. Don't get me wrong. Sometimes the canal is not filled perfectly fine, and that happens. But I want to talk to you about other factors that can happen so you do not always blame the healthcare professional and the dentist for doing something wrong. Because on the patient's mind, the first thing comes into their mind whenever a root canal therapy has been done is that, did the dentist do something wrong? I had a root canal therapy, then why am I still in pain?
Why?
And that's what I would like to talk to you about. And what happens is after that, sometimes the retreatment is done because they want to make sure all the canals are sealed. Then if that doesn't respond and the tooth still is painful, what is done is called apicoectomy. Apicoectomy is a process that basically, like right here that you see the bone is exposed, with a surgical procedure, they reach the root of a tooth where the root canals have been performed, and they basically do a tiny amputation of the tip of the root of the tooth. So when the root is cut, then they plug that area basically to make sure that they seal it and there is no communication. Does that take care of any accessory canal? If the accessory canal is more at the tip of the root, yes. But if the accessory canal is more on the top area, very likely you will still experience pain and problems. Then what? The next thing after that, of course, if the tooth still acts and behaves painful, sometimes there is a fracture, a vertical fracture. If one of these roots has a fracture in it, and you cannot necessarily see that on the x-ray, sometimes a CT scan can show the fracture. So what they do when there is a fracture, no matter what you do, no matter how good and nice your root canal is, that tooth will be painful because as you put the pressure from top of the tooth,
Pressure, push it down on me, push it down on you.
the fracture flexes and it's painful. If that happens, don't worry. There are solutions for that too. The worst case scenario is like this situation right here, that a tooth has acted up. No matter what we do, we cannot control the pain. Then the tooth is extracted and we can place a nice implant in its place. And the implants in general are a lot more predictable than root canal therapy. I am not telling you that root canal therapy, is less problematic or implant is, less problematic. They all have its own set of problems, but in general, implants are more predictable and they have generally less problems. So with that in mind, as they always say, an ounce of prevention is worth a pound of cure. Make sure you keep your 6-month checkups. Make sure you prevent getting root canal therapies by getting the small cavities taken care of. But if a root canal therapy is needed, please do not feel bad about it. It's just another dental procedure. Get it done and then focus on rest of your great teeth and good teeth to save them and keep them for the rest of your life. So don't forget, you are the most important person in your life. So take good care of yourself and keep your 6-month checkups.